In the event of a large-scale public health emergency, time is critical. We plan for the worst-case scenario. When many people are exposed to a harmful agent, the local health department will work with local, state, and federal officials to determine the best response. Hello, I'm Tracy Matisak for the Medical Reserve Corps, or MRC. You are watching this video because you are interested in assisting with a mass medication or vaccination response in Pennsylvania. In order to serve our population, we will need strong volunteer support. We thank you for your willingness to volunteer. As a volunteer, you will staff a mass medication center, also called a pod, or point of dispensing. Pods are designed to distribute medication or administer vaccine quickly to large numbers of people. This video will review several main concepts about mass medication and vaccination and give you the information you need to respond appropriately and safely. We will provide an overview of mass medication response strategies, and operations may differ by county or by pod site to best fit the situation. The main topics you will learn about in this video include an introduction to points of dispensing, or pods, what roles MRC volunteers could be asked to perform when working in a pod, an overview of each station and its function, responder safety concerns, line management, security, serving vulnerable populations, and debriefing and demobilization after your volunteer service. A pod is a place where thousands of people could receive medication or vaccine during an emergency. The goal of a pod is to serve the public quickly and accurately. Pods are staged in facilities with large rooms or gyms, such as schools and recreation facilities. Pods will be staffed by government employees and volunteers. When you're standing in a medication pod, you'll see screening tables, the dispensing or vaccination area, and crowd control barriers to help with line management. A pod is typically set up in a large room to allow for large crowds and optimal flow of people. Some jurisdictions may use a drive-through pod model where the public stays in their vehicles while receiving medication or vaccine, and staff operate out of large tents. Depending on the specific type of emergency, the impact and duration, MRC volunteers may have a critical role in assisting government agencies in managing the response. Pod staff roles include management, medical staff for screening, dispensing, and first aid, and non-medical staff who handle line management, logistics, supplies, and staff registration. Volunteers with the appropriate qualifications and training may fulfill leadership roles within the pod. The pod manager is responsible for the overall pod setup and operations, including communication with the health department or emergency management. The assistant manager oversees the running of the pod, including moving staff between functions to improve the patient flow through the pod. The medical or operations lead manages the clinic operations, including the screening, dispensing, and vaccination functions and the first aid station. The non-medical or logistics lead manages the support functions, which may include a registration, training, or break room, a supply area, and runners who bring materials from the supply area to the dispensing or vaccination stations. And the line lead ensures that the staff keep the public moving quickly through the pod. While working in a pod, you will take direction from and ask questions of your direct supervisor within your assigned section. For example, line staff report to a line lead. MRC units may choose to pre-assign leadership roles, or you may be assigned upon arrival at the pod for your shift. MRC volunteers working in a pod will be notified about their shift or shifts via the ServePA system or using a Google tool. Upon arrival at a medication pod, each patient will complete a head of household form. The answers on this short form will help the pod staff to determine which medication should be dispensed to each member of the household. For a medication pod, one person can pick up medication for an entire household using this head of household form. This form will be tailored to the emergency and will usually ask questions about allergies to certain medications, pregnancy, and the need for pediatric dosing. Some of the public may print the forms at home and bring them already completed. Patients can also complete their forms while standing in line, and line staff will be available to assist with completion of the forms. Screening is the first station in a medication pod. This is where patients will encounter pod staff who will review the head of household forms and use an algorithm to determine the appropriate medication and dosage for each person listed on the form. The setup of a vaccination pod will differ slightly because there will be no head of household model. Every member of the household will need to report to the pod for vaccination. Screening and vaccination stations may be combined with an additional data entry station if this technology is available. Adverse events, such as injury or allergic reaction to vaccine that occur within the pod, should be reported immediately to pod leadership. Responder safety includes appropriate personal protective equipment and education on any potential risks of the agent or disease. Mental health concerns will be discussed later in the video when we talk about debriefing and demobilization. Responding volunteers will receive the appropriate medication or vaccine for themselves and their families. You will also be provided with appropriate personal protective equipment, which may include gloves or face masks. Information about the disease or agent will be disseminated prior to deployment through the MRC unit coordinator, including risks of transmission, and updates will be given as necessary. Strong, assertive line management is the linchpin of this whole operation. Moving people quickly and safely through a pod is essential to ensure everyone receives medication or vaccine. Ideally, line staff will include behavioral health specialists who can work with the public while they wait, and people with various language skills to assist with translation. Line staff will also report rumors to the line leads so they can be addressed within the pod or through the media. The safety of our volunteers is paramount. Each pod will have a security presence. The perimeter will be secured, and interior and exterior security sweeps will be performed before any volunteer deployment and at regular intervals. It is important that volunteers do not put themselves in harm's way. If you have a security concern, please let security and pod management know immediately. Health departments have plans to offer medications to at-risk populations through planning with organizations that serve vulnerable populations like the elderly, those with functional needs, or the homeless. For those individuals who do not receive any services yet have functional or access needs, pods will offer handicap accessibility and accommodations to help the blind and hard of hearing. MRC volunteers will support the public health response for the duration of the incident or for as long as their services are needed. Debriefing should occur after each shift. This will likely occur via a survey or conference call with the MRC coordinator. Depending on the incident, demobilization may include a mental and physical health assessment. We encourage volunteers to be aware of their physical and mental health needs while responding. Report any injuries or stressful situations as soon as possible to the on-site manager or unit coordinator. For demobilization, MRC volunteers should ensure the following: that all assigned activities are completed, if additional assistance is required, that all issued equipment and supplies are returned and accounted for, and that the volunteer checked out at the end of his or her shift before leaving the scene or site. We hope that we never need to operate pods on a large scale, but it is imperative that we prepare for the worst-case scenario. You are an important player in these response plans. Thank you for taking the time to help us be better prepared, and thanks for watching.